Angela Springer.
And I'm Chloe Klauser.
And we're licensed midwives with Natural Birth at Home in South Carolina. This video is all about how does midwifery care work?
Yeah. So one of the ways that we're similar in the OB model is we do the appointments at the same schedule. So every 4 weeks, we'll have office visits here, and then once you hit 30 weeks, we'll switch to every 2 weeks, and then at 36 weeks, we'll go weekly until you have the baby. We also do all the same testing. We have many different options for our testing, so that's where it differs, is that it's all individualized and up to each woman and what she feels is best for her, but we do offer all of the same tests.
Yeah. And we come to your house at 36 weeks for a home visit, just to make sure that, we know how to get to your house, that everything's all set up for your birth, drop off some supplies. It's really kind of a fun time, it makes it really real. Because when you're in labor, you're going to give us a call, and one of us will answer the phone, which that's pretty different because we're going to always be available to you 24/7. And so we rotate call, and one of us will show up at your house and, be with you until you have your baby.
Yeah. And at the home visit is where we really get to envision, okay, where do you plan to have your baby? What do you want it to look like? Who do you plan to have here? And during your prenatal visits, we have gotten to know you because we spend an hour with you, which is nice. We'll talk about that more in a second. But so we know your birth plan. We know everything that you really hope and desire for this birth. And you don't have to ever worry about trying to fight us.
Yeah, for sure. Yeah, those hour-long appointments is the main thing that really makes prenatal care with us very different. So we may work on the same schedule, but we really set aside an hour for every prenatal visit with you, and that's face-to-face time with one of us. So when you come, you're not sitting in a waiting room waiting for your appointment. You're not sitting in an empty exam room waiting for your few minutes that you get to see your provider. We really set aside time. You may not need that whole hour, and that's totally fine, but we really spend a lot of time getting to know you and what you want.
Yeah. And during those appointments, we're also trying to listen to you. We want to hear how you're doing, how you're feeling. Yeah. We think that pregnancy should be this beautiful time in your life that you look back and you love. We don't want you to be miserable the entire time. And since we can't write prescriptions, we're talking about nutrition and hydration and supplementation and all the things that can really keep you in that low risk category, but also enjoyable.
Yeah, for sure. So our care is very different in some ways, and one of the other ways is postpartum care. So you've had that baby, and you're at home, and we stay for a few hours after the birth, kind of have a checklist of all the things that have to be okay before we can leave for you and baby. But we're going to come back and see you again in 24 to 48 hours, and probably a couple more times. So you don't have to leave your house. You don't have to pack up a baby in a car seat. You don't have to go anywhere. You just get to really rest and recover in your bed with your baby, skin to skin for, weeks. It's great.
Yeah, we really live in a society of forgotten mothers, because during pregnancy, we're all worried about you. And then once the baby's here, it becomes all about the baby. Yeah. But we really believe the healthier and happier the mom is, the healthier and happier their baby is.
That's right. And if you want to have successful breastfeeding, really staying home and being skin to skin with your baby is the best thing you can do. And just for recovery, postpartum recovery will go so much faster and better if you really can rest. But, loading up a baby and going to a bunch of appointments in that first week, nothing restful about that.
Yeah. And again, we really put an emphasis on your emotional well-being as well. Sure. Again, we just want this to be such an enjoyable experience.
Yeah. Anything else we forgot?
I think we covered it.
All right. Well, if you have any questions, let us know. Feel free to message us or send us a form on the website, and we'll get back with you.